evening. The pharmaceutical giant AstraZeneca has announced where its new multi-million-pound site in Cambridge will be. The company, which develops drugs, is setting up new headquarters on Cambridge's Biomedical campus near Addenbrooke's Hospital. It's been chosen so that the company can tap into the world-leading science sector already based in the city.
This is their vision, a 700-acre campus where university and hospital buildings sit side by side. What is now fields, groundbreaking research into diseases like cancer, multiple sclerosis, diabetes and dementia will take place.
The AstraZeneca site here will be around 11 acres, 2 plots, one here and one across the road here. By the company choosing to come here, this will be one of the biggest biotech clusters in Europe, what they describe here as a ABC village. That's academics, business people and clinicians all working together in close proximity.
The new building will cost around £330 million. It will employ around 2,000 workers and should be finished by 2016.
We'll be able to take the knowledge that comes from the benches in the laboratories of AstraZeneca and we'll be able to convert that knowledge into better patient outcomes. So a once-in-a-lifetime opportunity for us as a hospital and as a biomedical campus, but really a lifetime opportunity for patients, not only locally but nationally and internationally.
AstraZeneca's site to the south of the city will close, and around 1,600 workers from here in Cheshire will move to the new HQ in Cambridge.
Obviously there's going to be some stresses in terms of the housing, maybe the housing bubble will start growing again, but overall having 1,600 new jobs and a new headquarters from a global biopharma company is just great news.
The hope is this campus in Cambridge will become a world leader in medical research, working to help patients in this city, country and across the globe. Mike Cartwright, BBC Lookings.
The chief executive of AstraZeneca says the UK has a great track record at developing new drugs, but then is very slow in bringing those medicines into use for patients. I met up with him earlier and asked why he thought that was the case.
The UK as a country, as a market, if you will, is sometimes, indeed slow to take up new medicines because you have a number of barriers to go through. I think what is actually totally justified is that we should demonstrate as an industry, we should have to demonstrate that our medicines are bringing value for money, they're helping patients and they're cost effective. When this has been demonstrated, for instance when NICE, which has pretty high standards from a cost-effectiveness viewpoint. When NICE has said, yes, your product is cost-effective and is a good product, then it should be used rapidly. Whereas today what we see is, even when NICE says, yes, it's a good product, it's cost-effective, the utilization is pretty slow.
You talk about cost-effectiveness of drugs, and of course we all know that health budgets are being squeezed and everybody wants cheaper medicines without compromising on the quality. What impact is that having on AstraZeneca?
Well, it has to start with an impact on the whole industry, and the impact on the whole industry is that we have to become even better at innovating. We have to become even better at coming up with new medicines that really help patients and are cost-effective.
The Prime Minister, David Cameron, has said that the UK life science sector is pound for pound the best in the world. Would you agree with that?
In many ways I would. I think the one thing that this country could do a bit more of is investment in academic research. You know, this country has some of the best academic institutions in biology research, in medicine, and so it's up to all of us, academia, government, large companies, small biotech companies, to actually work together to show that the Prime Minister is right and that this country is one of the best places in the world to come up with new medicines.
You're investing more than £300 million in this new Cambridge site. How long can we expect AstraZeneca to stay here?
Oh, we are here for the long run. I think you can expect that we will be here for many years. Cambridge University is here to stay. All these academic institutions, the hospital, they are here to stay. So we are also here to stay.